All right, everybody, we are going to get started. For those of you not familiar with me, my name is Rob Valencius. I am the National Agent Trainer here at Pinnacle Financial Services. Today, we're going to be talking about some exciting stuff with Guarantee Trust Life. We like to call the hospital indemnity products kind of like handcuff policies for Medicare Advantage, meaning they go kind of hand in hand. They're one of only a few extra things that are on scopes of appointment that you can market to other people. So what we're going to do is I'm going to go over a couple things, talk a little bit about Pinnacle. I'm going to show you how to quote hospital indemnity through our CSG software on our website, and then I'm going to play about a 12 or 13 minute walkthrough from Guarantee Trust Life that shows you all the features that I think are really important for their side of the quoting and enrollment, as well as the email quote. So I'm going to try to get you guys out of here in about 30 minutes. A couple housekeeping notes. Keep in mind your phone is muted. Mainly we do that so there's no unnecessary distractions. Kids yelling, dogs barking, garage doors, all that. That does not mean you can't ask me questions. There's a chat box there. Feel free to ask me questions at any time. I'm happy to answer anything that you guys have as soon as you answer it or ask it. And if I don't get to it right away, we'll try to go over to the end of the presentation and I can answer it there as well. So I would like to start these webinars off by talking a little bit about Pinnacle Financial Services. We've been around since about 2001. Kevin Shield Sr., our principal and one of our owners, he was a door knocker in the 80s for the long-term care side of the business. Worked his way up, eventually was one of the head guys at Conseco / American Travelers in the long-term care era. He left, bought the division. Pinnacle was born. We were strictly long-term care up until about 2005, and that's when we added Medicare Advantage when it kind of officially hit the market, and we kind of never looked back. That's about roughly 55 to 60% of our yearly business. Medicare just has fantastic dividends. Not to mention it's not a 50-page app like long-term care. So, but I always like to show our office here. I mean, from an experience perspective, I've been with Pinnacle for almost 7 years, so that's just me. Bob, Ange, and Kevin have been working together since the 80s and early 90s, so there's a lot of experience in the office. We are based right outside of Philadelphia, Pennsylvania, and we don't like to try to hide from people. That's what I always like to point out with this. It's important to take a look at this and see that, we have pictures of everybody in the office. We have social media. We have extensions. We have email addresses. Should you need my information, you can find that all here on this page as well. And really, the point of that is that, if you go to call somebody in the office, you're going to get a human. You're not going to get a robot. You're not going to get a secretary or a gatekeeper, as we like to call them. We don't hide from people. Our sales teams split up into some teams, and at this point, they have different sets of states. We really kind of do that because, say, Cody's out traveling, which we're starting to do a little bit more of now. Dustin and Nick are in the office, and they're able to answer your questions about the area just as well as Cody. So you'll always have a point of contact in the sales division, but you'll have other people that can also help you should you need it. Now, it's important to note that, we do also have a life annuity long-term care sales team as well. They're by product line, so you have, Mark and Warren, they handle the life and final expense products, and then you have Will and Josh, they handle a little bit more of the complex life annuity long-term care situations, and then actually Josh runs the whole division now. He's still working with agents. He's been with us for a long time and was recently promoted, so congrats to him. So that's our team here. Always like to start with that. I think it's important to kind of see who you're doing business with. Let's talk a little bit about Guarantee Trust Life, hospital indemnity in general. So for those of you unfamiliar with hospital indemnity, Basically, it pays all of your costs, or depending upon the policy that you have, it helps cover the gaps of your Medicare Advantage policy. Now, Dimitri, one of our sales reps, one of the main sales reps at GTL, he would argue with you that it's also great for Medicare supplements as well. So I can't just say it's just for Medicare Advantage. But the reasoning behind it is especially as healthcare costs are going up, inpatient hospital stays is one of the larger gaps that your client can incur if they go into the hospital. So, a lot of the policies now are, days 5, 6, 7, and out-of-pocket exposure could be, $250, $350, $400 with some plans. So the idea behind it is you pay a small monthly fee, and should something happen, and you can prove to GTL or whatever company you have the indemnity with, because there is multiple companies. GTL is just going to be the main one we're talking about today. You prove to them that you were in the hospital, and they pay you. Now, here's the caveat to that, or the bonus to that. You don't have to use the money for your bills. You can actually use that money for anything. You can pay. You don't have to pay your hospital bills. You can pay your utilities. You can go on a vacation. You can just put it in your savings account. That's the beauty of it. So, let's see. I had a question here. Can all, most, or some of the products be sold to the under 65 market, having nothing to do with Medicare? We do have different indemnity products. The one that we're going to be discussing today is not designed for people under 65, but there are ways to utilize this to go down. I think I want to say there's one that goes down to age 40, depending upon what it is. So there is products out there, and there's companies we work with that do offer products that go down. I think the GTL product, I believe, it starts at age 40. We have to take a look at it, but I haven't been in the sales market for a little while, so some of the little caveats, kind of out of the loop on that. So we can always check on that for you, Steve. And these, what we're going to be talking about too. I mean, the nice thing about the GTL product we're going to be discussing is that it is guarantee issue for 64.5 to 65.5. So it is a product that you can get people through with no underwriting. And it does have it's a jet simplified issue product. So there's 5 questions. They can answer no to everything, and one is HIV or AIDS. So that's the beauty of that. So this is our software here. Under online enrollment, you could do MedSup enrollment here, and under Medicare, you're going to want to click here for Medicare quote. It's going to take you to our CSG actuarial software. Now, most people, if we're talking hospital indemnity, they're just going to go straight to hospital indemnity. I don't actually recommend doing that. I recommend going into the Medicare Advantage side and running a quote, and I'll show you why. So we're going to just run. This is Warminster, Pennsylvania. It's where our office is located. Don't mind the internet. Okay, and let's just take a look. Let's take a look at this Cigna Alliance plan. This is the plan my stepdad's on, so it's a plan I'm familiar with. So you can compare up to a bunch of these plans. We're not going to go into the full software for CSG, but I want to show you how to do this through our software. And I don't want to muddy it. You can do up to, I think you can compare up to 5 with this software, but the screen gets pretty busy. So by only comparing 1 with the indemnity, you can really see what's going on. So it lists everything here side by side. Okay. So what we're going to do, I don't want to have all those details there. So what we're going to do is in the upper right-hand corner here, you can see there's a bunch of different buttons. Okay, the fill the gaps button is the one that we're going to look at. Excuse me, is the one we're going to look at today. This is hospital indemnity. Make sure unlike Medicare Advantage, which doesn't really care if you're male or female or just really age-based. This is going to be, you're going to need to make sure you have the correct zip code, the correct age, male, female, and tobacco usage. So we're just going to run a female, age 65. Now, like I said, we have a bunch of different products. Aetna has a product, Medicare has a product, Bankers has a product, Heartland, all this. GTL is, in my opinion, the best of the bunch. And the standard one is 10 days. That's the one that we see the most often. Now, a lot of people don't realize this, and like I said, this isn't a product demo. I'm not going to go into a ton of details. But the cool thing about their product specifically is okay, you have a 10-day benefit. All right. Say you go into the hospital for 5 days, and then you go back in 30 days, and you're in another 5 days. Well, now you have 0 days left, but you got paid out for the 10 days. You paid your bills, whatever. And then let's say 6 months down the line, you go back in. Well, your 10-day benefit restores after 60 days of non-confinement. So in reality, theoretically, you could get 20 to 30 days out of the policy, if not more, depending upon how much you're actually in there, because it resets every 2 months. So that is a great side to the fact that even though it's only 10 days, it does restore when there's not confinement, which is nice. So the cool thing about the software is it's going to put everything side by side. So all right, here's the important thing, right? Oh, of course, this doesn't tell you how much. All right, well, we're just gonna, the average is about $250 a day. So everything that you enter here, normally it's gonna have it right here, so you can add up the benefits. So in this case, $250 would be $27.53. Okay, ambulance. They do have a bunch of different riders on this policy, which is really nice. It's like an all-in-one. This is probably the benefit I tell people to add the most. It's in most cases, if you're spending a couple days in the hospital, more often than not, you're taking an ambulance some way. You're not driving yourself there. So I always recommend adding this. So you probably want to do about $250, and the cost here is minimal, $525 a month extra. So just covering the inpatient and the ambulance, this is only $32.78 a month with the 0 premium Cigna plan. And if the person goes into the hospital, they're going to make money here. They're going to make they're going to make a $10 on the ambulance. And I don't remember what the confinement is here. Let me see if they list it down here. Here you go, inpatient. It's $285 for days 1 through 7. So actually, we would want to adjust this to like $290. So you can play with this. You can do $290. You can do $280. To be safe, I'd say do $290. So it doesn't make that much of a difference here. So it's an extra $5. So $37.19. So that's going to cover more than their daily benefit, and if they take the ambulance. There's some other stuff here. Lump sum cancer. There is a lump sum cancer rider, as well as a reoccurrence benefit built into the plan. This is going to add 5 questions, and it's also you don't get guarantee issue with the cancer. So just kind of keep that in mind. But in some states, there's dental, like here in PA. You can add dental, $400, $800, $1,200 per year. That's a little. It's going to add some vision as well. There's skilled nursing. So you can sit here and you can really customize all of these. There's an outpatient surgical. There's an accidental death and dismemberment benefit you can add. So all of these things can be added to the policy. Commissions are great. Obviously, the more expensive the policy is, the more commissions you're going to make. But really, at the end of the day, it's about covering the gaps and really helping people. And in that specific scenario, you could. So We had a question here. Can we enroll in the indemnity plans at any time, or do we follow AEP, OEP, and SEP rules? Stephen, the nice thing about these is they're indemnity. So you can sell these whenever, wherever. There is no rules with enrollment. The only thing that they have is the guarantee issue between 64.5 and 65.5. Outside of that, if they can answer, it's like picture it like a final expense, a very simple final expense. If they can answer a couple underwriting questions, they get accepted. And typically, you get paid within 4 or 5 days of it being issued, which is pretty good. This is a volume style market as well. So the more you do, and there's renewals. Obviously, it's front loaded, so you get good commissions year 1, and then okay commissions year 2 through 10, and then maintenance fees at that point after that. But if you're doing a decent amount of these, you're really going to come out on top. So that's how you run that through our software here. Now, I'm going to play the video. This is going to walk you through GTL's side of it and actually show you the actual ability in terms of the email quote to consumer. Okay? Had another question. Once a plan is accepted, how long is the waiting period before it can be used? There is no waiting period, but they do have, they have a look back during the underwriting, and they do have I guess a pre-existing conditions clause. So, I believe it's 6 months for the pre-existing conditions. But if it's something that doesn't involve a pre-existing condition, then it could be used pretty much right away. So like if the effective date is July 1st and they have to take an ambulance July 2nd, it can be covered. And in some cases, like the cancer policy, we've seen people get the cancer policy and 2 months later they get diagnosed with cancer. They had no idea, and they get a lump sum payout of $10,000 from their policy. So it's definitely something that you don't necessarily have to worry about, which is great. So, all right, I am going to get this started. If you guys can't hear the audio, please put in chat, can't hear the audio, because I don't normally play videos. I normally just do it myself, but I felt that this is a pretty good. They're walking you through step by step, so it's pretty good. So give me 1 second here. I'm going to get this started.
On your screen as the agent, I have it listed in parentheses here. As we go throughout, you'll see that change to client when it switches over to the client point of view. First things first, though, you want to note that the quote to consumer function is for plus apps only via the agent portal. First, you're going to want to go ahead and select your benefits, the calculated quote as you would normally, and then at the bottom of your screen here, circled in red, you're going to select invite customer to apply. Second, you're going to fill in your client's email address as well as your email address, then click send. Here's a quick little screenshot of that below here. You'll see I have my email address as well as my personal email address listed to be referenced by our live. After you go ahead and click send to your client will then receive an email requesting that they complete their Advantage Plus application by clicking complete application. And note here at the top of your screen, you'll see in parentheses it's client. This is what it's going to look like on the client's side. Once they go ahead and click get started, your client will then be shown this screen below explaining they will need to answer some background questions and provide additional information. But first, we'll be shown a summary of the benefits you have selected for them. Next, your client will be shown the summary of benefits selected, as well as their basic information before starting the application. As I mentioned earlier, this will make it a little easier and more accurate for the client to confirm all their information was entered correctly, as well as the benefits selected. If, for whatever reason, anything needs to be changed, you can always go back to the application and make changes where necessary to the Save app underneath Review and Resume. Once this is all confirmed, The client will then select Start Application and will be directed to their background and health questions. Once they get to the next screen, your client will then be asked if they are replacing any coverage and will then complete the underwriting questions if applicable. You can see that pictured here below. Will this policy replace any existing insurance with any company? No. And then here's a sample question for the underwriting. In the past 6 months, have you been confined as an inpatient to a hospital, nursing home, or received home health care? And just as a friendly reminder, your insured will not need to answer those underwriting questions if they are within the guaranteed issue age range of 64.5 to 65.5. Once the questions have all been answered, your client will then follow the instructions to fill in their personal information. You see here, they're confirming their name and social. Next to that, they'll be entering their address, city, phone number, and email. Now, lastly, your client will have to fill in their payment information on the below screen. They're almost done here. Funds are their banking here, routing. And then lastly, your client will sign GTL's terms and conditions. They're going to answer 2 security questions to verify their identity and submit. Note, no voice verification call is required. The 2 security questions we require them answer are going to act in place of that. So like I said earlier, you're not going to need to coach them through that phone call or worry about anything bouncing back on you. All right, now it comes back to you as the agent. Now that your client has done their part, you are then going to receive an email telling you to log in and submit the consumer filled application, and it'll look just like what is pictured below here. You see a big blue button here. You're going to log in and submit the application. All right, and this is going to be the last step for you as the agent to do. After you're going to log in and navigate to the review and resume option within the agent portal, you're going to find your consumer filled app and click sign and submit. Once submitted, you're right there on that same screen. And as the agent, you're done. If anything needs to be followed up with, you're going to receive an email from underwriting. But that's pretty much it. It's pretty short and sweet. Try to make it as easy as possible to understand for both you and the agent. And like I said, this is going to end up being a huge time saver for you guys. AEP is right around the corner here. You'll find it very, very useful to get used to this process. As for now, I'm going to go ahead and navigate over to Google. I'm going to show you guys a live just how easy this whole process is.
Okay, so could you put in the chat, do you guys want to see this live demo of their quote and enroll software? I really just wanted to show you the email side to it, but I can show you this as well. Can I get a show of just a Y for yes, an N for no in the chat box? I'll give you guys a minute. We have a majority of yeses. So I'm going to play this. It's only about another 9 minutes. So sit tight, and if you guys have any questions that pop up, just feel free to ask me.
All right, your GTLIC.com on the top here for you. Go over to agent login like you normally would. Enter your username and password. Mine's auto-filled in here. You'll log in. All right, then you click on the quote submit here on the left-hand side, like you normally would for any Advantage Plus application. Your client's first name in here, just for sample, John. The birth date we can leave as today's date. Effective date is going to be 5/11/2021. Select state, we're here in Illinois. Click next. You'll scroll over to Advantage Plus quote selections. Remember, it is only available via Plus. You'll fill out your benefits. We'll do 10 days, $250 a day. We're always adding on an ambulance rider and a short duration stay. You scroll down to the bottom here. Like normal, you'll see the calculated quote here, including the first month's application fee. And then, like we saw earlier, you see the button down here, invite customer to apply. You'll enter your email address as the agent, as well as your client's email address. And just for this example, I'm going to be using my personal email address so you can see how it looks on everybody's screen. You'll click send. They should receive an email very shortly. I'm going to head right over here to my personal email. All right, pretty instantly. Alrighty, give it a second to download. There we go. You'll see here you have received a request from, this will be your agent name here, to complete your GTL application. You simply click complete the application. And then it'll take you into the prompt like we saw before. Let's get started. We're going to review our name, date of birth. Everything looks right with the benefits. You'll note here that it says $31.03 is going to be billed per month, and you'll see a $20 application fee will be applied on the first month. Sound good? We start the application. Will this replace any existing insurance with any company? Nope. All good there. We click next. Let's get a few medical questions out of the way. In the past 6 months, have you been confined as an inpatient to a hospital, nursing home, or received home health care? No. You click next. And you see here you get a cool little status on the top right-hand corner. Pretty user-friendly to let the insured know how close they are to finishing up. Next, we'll answer the other health questions. No. Alrighty, everything checks out, and that's it. Thank you for answering the medical questions. Now we can move on to the other additional information. Alright, they already have your name auto-filled in there. You enter your social security. I'll just enter a random number. Alright, street address. We'll use the default address I use whenever I'm making examples. 123 Main Street, never go wrong. A random phone number. As you can see, I have this automatically filled. So I was doing a lot of examples with these. And then the email address, which was the personal one I used earlier. Boom, all looks good. Click next. And then their payment information, their account number, their bank routing number. These aren't actually real account or routing numbers. I just made them up on the fly. The requested draft date. This might be the only thing you really need to coach your insurance on. You have to remember the draft date can be any date as long as it is within 15 days from the policy's effective date. So remember, we had this policy take effect today, which was May 11th. So we can date this out all the way to the 26th of May. Just for example purposes, though, I'll leave it as these dates. Alrighty. And then if the different from the insured, you'll type a name here on this lower left bar, but the premium signature as it appears on bank records, all the insured's going to be doing is typing in their name here. All right, and here's the acknowledgments and authorizations page. They're going to have to scroll through this, make sure they read it all, and the signature again, it's going to be John Doe. Wherever they sign it, it's going to be their home, where their computer is. It's already pre-filled with today's date. And now here's the cool part that'll allow all of you guys to bypass the voice verification call. You can just select 2 questions here that they'll supply answers for. What's the last 5 digits on your state driver's license or state ID? I don't even know mine off the top of my head. These are random numbers. And security question number 2, we'll go with, what is the name of the elementary school from which you graduated? Right. All looks good. And then boom, we're submitting the application. You'll get a little thank letting you know your application has been sent to your agent, who will review the entered information, and then they'll submit to GTL. Just for added assurance here, they know they're done, because you see here on the top right-hand corner, they are 100% complete. Good to go. All right. I'll personally back over to my email, my work email at the agent. Here's the message. John Doe has completed the GTL application. It'll allow you a hyperlink to log in and submit that application. Go ahead and click that. You prompt to log in. Alrighty. And just as is the case with any of your saved applications, you want to head over to the middle section here, labeled Review and Resume. Now, what's new is that there's now color-coded categories. You can either show all applicants here, which is in the dark blue. You can click green, which is show client-filled applications, or the light blue, just show the agent-filled applications. We're going to show client. As you can see here, we have a John Doe. All you have to do as the agent is click this Sign and Submit button. You don't have to do anything else. You'll click that and give it a couple seconds here to load. It's generating a policy and being sent to our underwriting department right now, and boom, you're done. This is going to be your client's policy number. In a short while here, the client will be emailed an outline of coverage, as well as a HIPAA practice forms, as well as you, the agent, will get those as well. That's the entire process. Like I said, it's very, very simple. It's very quick. It's going to end up saving you guys a lot of time on your appointments, both now and when AP does roll around. It's right around the corner. I highly recommend using this as much as you can, just so you can get out ahead of the curve and familiarize yourself with anything.
All right, guys, that's it. That was the demo. I wanted to show that to you guys, and that's our presentation today. So it's late on a Friday afternoon. As always, I always like to thank you guys for taking the time out of your day to spend with me here. And if you have any questions, don't hesitate to reach out to us. 1-800-772-6881. My direct extension is 7701. You can reach out to me or really anybody else here in the office, and we'd be happy to help. This is something that we can get you contracted, and you can start writing pretty quickly. So feel free to reach out to me with any questions. I'd be happy to help. Thank you so much for your time today, guys, and I hope you have a great weekend. Thank you.